Hi, everybody. I'm Dr. David Kingsley, President of the World Trichology Society. I'd like to give you my reflections on the World Congress of Hair Research 2026 in Seoul, South Korea. The Congress brought together more than 1,200 attendees from around the world and featured over 300 scientific presentations delivered by leading researchers, clinicians, and industry experts. As the premier international scientific meeting dedicated exclusively to hair and scalp research, the Congress provided a unique opportunity to examine the latest developments in hair biology, disease mechanisms, diagnostics, and emerging therapeutic approaches. It also offered valuable insight into the direction in which our field is likely to evolve over the next few years. I think the key themes that I found: genetic hair loss remains the dominant research focus. Alopecia areata research continues to advance rapidly. Also, AI and diagnostic technologies are gaining attention. And lastly, combination treatment strategies are increasingly being discussed rather than single treatment approaches. Regarding my presentation, one thing I was particularly pleased about was that it addressed a topic that wasn't covered extensively elsewhere in the Congress: the role of the trichologist within the broader hair loss care team. I've made this presentation available separately to view on this platform. For you tricho geeks out there, while there were three simultaneous presentations going on at most times, I will go through the ones that I chose to attend. Here's a brief review of each segment. So, as I said before, I'm going to be briefly going over each session that I personally attended at the World Congress for Hair Research. They are not in chronological order of how they were presented at the Congress. Oncology session, this examined the mechanisms responsible for both temporary and permanent hair loss associated with cancer therapies. Particular attention was given to emerging strategies aimed at preventing treatment-related alopecia, highlighting the growing recognition that hair preservation is an important quality of life consideration for oncology patients. In the trichoscopy session, it showed that trichoscopy continues to evolve as one of the most valuable diagnostic tools in hair disorder assessments. This session reviewed both fundamental principles and newer applications, demonstrating how trichoscopy is increasingly being integrated into routine clinical decision-making for both scarring and non-scarring alopecias. In the hair fiber and scalp care session, this session highlighted the growing convergence between cosmetic science, scalp biology, and clinical trichology. Presentations explored hair fiber quality, pigmentation, scalp microbiome research, and emerging approaches to scalp health management. This was also the session in which I presented on the role of the trichologist within multidisciplinary hair loss care. As I mentioned before, this presentation was recorded separately and is on this platform in a different video. One of the Congress highlights was a keynote presentation tracing the remarkable scientific journey from the early understanding of alopecia areata to the development of JAK inhibitor therapies. The lecture served as an excellent example of how translational research can transform patient care when laboratory discoveries successfully reach clinical practice. In the genetic hair loss session, it was emphasized that androgenetic alopecia is not a single clinical entity, but presents differently across sexes and patient populations. Discussions focused on tailoring treatment strategies to individual patterns of hair loss, hormonal influences, and patient expectations. The next was the hair cosmeceutical session. In this session, considerable attention was given to the expanding role of cosmeceuticals, microbiome-based interventions, and metabolic influences on hair growth. While many emerging approaches remain at varying stages of evidence development, the session reflected growing interest in combining medical, cosmetic, and biological strategies to improve outcomes. In the burden of hair disorders session, it was reinforced something trichologists witness every day. Hair disorders often carry a substantial psychological burden that extends well beyond the physical symptoms. Presentations explored quality of life, emotional distress, scalp discomfort, and the increasing use of patient-reported outcome measures in both research and clinical practice. In the hair metabolism section, it was highlighted the increasingly recognized relationship between systemic health and hair biology. Topics including nutritional influences, metabolic pathways, endocrine function, and the complex interaction between internal physiology and hair growth regulation. The honorary lecture provided fascinating insights into emerging research on hair follicle stem cell signaling and its potential implications for future therapeutic development. It served as a reminder of how rapidly our understanding of follicular biology continues to expand. In hair follicle immunology, the research remained central to understanding many hair disorders. This session explored immune privilege, innate defense mechanisms, inflammatory signaling pathways, and the ways in which immune dysregulation contributes to disease development. The basic concepts in alopecia management was designed primarily for allied healthcare professionals. This session focused on practical aspects of hair disorder assessments and management. Topics included clinical photography, dermoscopy, procedural techniques, and the essential skills required to support patients within multidisciplinary hair clinics. The pigmentation session examined the biology of hair pigmentation with particular emphasis on melanocyte stem cells, follicular aging, oxidative stress, and the mechanisms that contribute to hair graying. The presentation highlighted how pigmentation research is increasingly intersecting with broader studies of aging biology. Regarding the emerging treatment session, this reviewed both established and emerging therapies, reflecting the growing trend towards combination treatment strategies and individualized patient management. The John Ebling lecture was a particular highlight for me as it was presented by Dr. Gillian Westgate, a valued member of the World Trichology Society Board of Advisors. Her presentation reflected decades of pioneering research and provided an excellent overview of the scientific discoveries that have shaped much of our current understanding of hair fiber biology and the hair growth cycle. In the energy-based devices session, interest in energy-based therapies was shown to continue to grow. The session explored the biological mechanisms and clinical applications of photobiomodulation and other physical modalities, examining their potential role as adjunctive approaches in hair restoration. The plenary session showcased some of the most significant and highly rated scientific presentations submitted to the Congress. Collectively, these presentations provided an excellent snapshot of the most promising areas of current hair research. The Alopecia areata update session provided a comprehensive update on the rapidly evolving management of alopecia areata. Discussions reflected how dramatically the treatment landscape has changed in recent years, particularly following the introduction of targeted therapies. Overall, I found the World Congress to be scientifically outstanding and among the strongest hair science meetings I have attended. While much of the focus was understandably directed towards her basic science, molecular mechanisms, and emerging therapeutics, the Congress provided invaluable insight into where hair research is heading over the next 5 to 10 years. For anyone interested in the future direction of hair science, the Congress was exceptionally worthwhile.